All right, let's talk about the intrinsic muscles of the larynx. All right, this is looking at the larynx from a posterior view. This large muscle that you see here is the PCA, posterior cricoid, and then it goes to attach to the muscular process of the arytenoid. PCA, the only abductor muscle of the larynx. All right. The LCA you really can't see, but it comes up from the lateral portion of the cricoid cartilage, and it enters the muscular process of the arytenoid cartilage. LCA, lateral cricoarytenoid, is an adductor, all right, of the vocal folds. You see the IA muscles here, interarytenoid. Transverse is the only unpaired muscle of the larynx. It goes from one arytenoid cartilage across to the opposite. All right. Transverse IA or interarytenoid. Oblique IA are here. All right. The oblique IA originate on the base of one arytenoid cartilage and go to the tip of the opposite arytenoid cartilage. These are paired. These adduct the tips of the arytenoid cartilage. All right. Where the arytenoid cartilage ends, you see a continuation of this interarytenoid muscle. All right. That is known as the aryepiglottic muscle. So when the oblique IA stop at the arytenoid cartilage, their continuation, although it's the same muscle, is named differently, and it is known as the aryepiglottic muscle. The aryepiglottic muscle underlies the aryepiglottic folds. All right, let me turn this. Oh, there, wait. All right, here you see a little glimpse of the LCA, all right, lateral cricoarytenoid. This muscle that you see here, all right, is the cricothyroid muscle, CT muscle. Remember, that's responsible for pitch change. All right, the CT muscle has two bellies, pars recta and pars oblique. Pars recta and pars oblique. Pars recta means straight. Pars oblique means at an angle. All right, let me just... All right, here you see that it's a ligament that I didn't have a chance to mention before, and this is the hyoepiglottic ligament, all right, and this is an extrinsic ligament of the larynx, hyoepiglottic, and right beneath this, right in this area, all right, is the thyroepiglottic ligament. And remember, the thyroepiglottic ligament is an intrinsic ligament, and it attaches the epiglottis to the thyroid cartilage. And looking from inferior to superior, so you're looking through the trachea, all right, here is the glottis, here are the arytenoid cartilages. These two muscles here are the muscles that make up the vocal folds. So you're talking about TA muscle, all right, thyroarytenoid. Here's your vocal ligament at the edge of the TA muscle. And remember, the TA muscle is broken down into two muscles. The most medial portion here is the vocalis muscle, and the more lateral is the thyromuscularis. And right here you see the vocal process of the arytenoid cartilage, but you're looking at the vocal folds from below, or from the trachea. All right. Here are your arytenoid cartilages, and remember, these two little cartilages on the top are the corniculates. And the cuneiforms, which are shown here, are going to be embedded in this aryepiglottic fold. All right. And underlying the fold is the aryepiglottic muscle. All right, there's one extrinsic muscle of the larynx, which you see here, and this is the thyrohyoid muscle. Origin is the oblique line of the thyroid cartilage. Insertion is on the hyoid bone. Remember, this is an infrahyoid muscle, all right, and it is the only infrahyoid muscle that serves to elevate the larynx. All right, that's it. I hope that helps.